With the COVID-19 pandemic and its related effects continuing to take toll on the world, its impact on mental health has been highlighted as a possible cause for further collapse of economies in the future. Today, health experts and journalists took part in a Ministry of Health meeting to find solutions to the different concerns. Although there are no official figures yet, ministry officials said the number of people seeking mental health services has increased since the country went into lockdown.
Because of the anguish, because of the mental breakdown of families, we have seen people lose jobs, and therefore they resort to taking even drugs.
Despite the rise in the cases, the country lacks capacity to deal with the burden, as around 80% of the country's mental patients remain in their communities without attention. It was also highlighted that many mental health facilities were converted into isolation centers for COVID-19 at many health facilities. Also, Uganda has just 46 psychiatric specialists in total, one specialist for every 1 million patients if the entire population needed mental health assistance.
Yes, the other thing that we need very much investment for is in the training of health workers, very specific for mental health. We have seen an increase in the number of psychiatrists from an initial 20-something. We are now getting up to about 50. That's a very good stride that is in there. However, the numbers are still very small. This is a very small number. Anyone would laugh at us because these are people who have to cater for all the 40 million people. We're saying 40 million because it's the population.
This shows that we are not giving enough emphasis on mental health, which affects a large population of our group population, which is why we are calling this year to call upon governments and everybody to invest more on mental health.
For us to talk about the solutions, the call center, the dedicated lines that, for example, with counselors, with the psychiatrists that can reach out to people when they call.
We have LC1, 2, 3, 4, and LC1 is community health structure. So we believe it's just the way forward, and I hope that this approach will be supported, and the health system in Uganda will be revolutionized well beyond COVID.
The experts have now called for government to consider increasing the mental health budget to safeguard the economy.
So they become unproductive, both the individual and their families. So it has implications. And by extrapolation, nations become poorer. When they have many people who are mentally unwell, the impact can be in the long term a poorer nation. Because we need people who are, you can have no leg and still be productive. But if your brain isn't working properly, it is very difficult to be productive.
Experts will hope their call is heeded, as a report by Twaweza Africa in 2019, months before the lockdown, showed that 80% of Ugandan households' income does not meet daily expenses. A less productive country may bring an even worse mental health situation. Edward Mhumza, NTV.